So you may recognize some of these. Okay, we already talked about the forehead. You know, the frontal bone forms, you know, the forehead region and also the superior walls of the orbits of the eye here. I'm going to lose my screen probably here. No. Okay, so it forms the ceiling. This process of the frontal bone forms the ceiling or roof of the orbits of the eye. Okay, so here's your frontal bone as you see it here. Oops. Okay, the superciliary ridges. We already talked about the front. Well, let me go to the frontal eminence again, just in case. I have a little duplicate here. Probably should not do that. The frontal eminence is here, is where you bump your head oftentimes. You get a bruise. Your superciliary ridges. Oh, not there. Here's your superciliary ridges here and here. So they're going to be in blue. There's a supraorbital margin, which is the superior margin of the orbit of the eye. That's here and here. This is the upper edge of the orbit. And then, of course, you have glabella again. I'm just going to put a purple G where glabella is. Hopefully it looks like a G. There we go. There is glabella. It's that prominence right between the eyes. Everybody good with that? Okay. There's a couple particular landmarks. One is the supraorbital notch or foramen right here in the medial aspect of that ridge. Okay, sometimes it's just a little notch in bone. Sometimes that it's actually a foramen. It has bone all the way around it, so it's a hole there. Just variations in anatomy. And blood vessels, nerves come through that notch or foramen from the brain to supply the forehead region. There is a particular process of this bone, and that's the zygomatic process. And let me pick a different color, do a blue. The zygomatic process of the frontal bone goes toward the zygoma. So here is the zygomatic processes of the frontal bone here. Well, I labeled it 2 here. Okay, so these are the zygomatic processes of the frontal bone. They are part of the frontal bone, and they're called zygomatic because they touch the zygoma. And Z marks zygoma.
Wait, what technically is the zygoma?
The zygoma I will make in red. Oh, let me find my ink again. Here we go. It's down here. I forget. The zygoma is the cheekbone. So the zygoma I'm going to outline in red. There is your zygoma bone. And we'll go over this again. There's your zygoma here. It also forms, you know, the lateral wall of the eye, but it's this cheekbone. Okay. As you see it here. Good?
Yeah, thank you.
You're welcome. Okay, the frontal sinuses are within the frontal bone, and you see the arrows pointing to these dark spaces here and here above the orbits of the eyes down here. I'll write an O on the orbit. That's the orbit of the eye. Looks like he's wearing glasses, doesn't it? If you just have little things going back here over the ear this way and that way. Okay, here's the nose piece of the glasses. So anyway, the frontal sinuses are shown here in cross section on the visible human, and you see them in the blue-green color. They filled all the sinus cavities up with this bluish green gel. And you see how large they are. You see it here in cross section as well as in this full frontal image. So they're very large spaces. So sometimes if you have a sinus headache, it's hurting up here, that infection, sinus infection has affected your frontal sinuses. And that's the frontal bone. So let's go to the occipital. Occipital is the back of the head and the base of the skull. The occipital bone, you'll be palpating, right, in your oral exam. You're going to palpate it along the base of the skull here and down the neck to feel for any enlarged lymph nodes, okay? And here you see it on the inferior aspect of the skull. It's a pretty big bone. And that's pretty much all I'm going to talk about with the occipital bone. Okay, it's not a big deal, really. The temporal bone.
About the occipital bone.
What about it?
It was like that little notch right above the big hole. That's part of it too, then, right?
Yes, it is. Yes. Yep. That's occipital bone here goes into the midline of that base of the skull. And it's going to join your sphenoid bone. It's going to connect with your sphenoid bone here. Why can't I draw on that? There we go. That's your sphenoid. Here, here. Okay.
Thank you.
And all the wings going up. Just get me started. I can just keep, I love this stuff. Your temporal bone. This is an important one. Okay, so there's a lot of details here. There is a squamous portion of the temporal bone. It's that fan-shaped portion here. It includes your process there. There's a tympanic portion. Oh, I should have done that in, I'll do underline squamous in red, just so you know I did it in red. The tympanic portion contains the ear canal. All right, so it's pointing right here to the external acoustic meatus. And then your petrous portion or mastoid portion is the inferior part of this bone. Okay, so it's all under here. This is the mastoid portion. Okay, it helps again to form the floor of the skull. So here's the inferior portion here. Here is that, you know, the inferior portion of your mastoid portion. It even goes up here. Let me go back again. The tympanic, okay, good. I forget what the tympanic is. But the tympanic then is within here. It contains the ear canal. So this is a really a large bone. It's got a lot of anatomical features in it. Okay. So let's look at some of them. Let's look at the processes first. Okay, your mastoid process is this large process behind your ear. There's your mastoid process. Okay, contains air spaces, and it's an attachment for that muscle we looked at before, the sternocleidomastoid that comes down the neck to the sternum and the clavicle in your upper chest. The styloid process is that very tiny, well, actually it's a pretty long process in many skulls. It's an attachment also for important muscles and ligaments that you need to know about. Very thin and delicate. And the styloid process is right here. It's a really cool thing. It's amazing. It can be an attachment. It's so thin. That's pretty cool. Okay. Here's that lateral view of the zygoma. You see here, it comes up here, and then it reaches out back here. We'll get more into the zygoma again, just to clarify that for any questions. It's also called the zygomatic bone. Zygoma is just easier to say, but it is still a correct term. Very important process is the zygomatic process of the temporal bone. This is the zygomatic process here of the temporal bone. It's a portion of the temporal bone, a big T, okay, and it is called the zygomatic process because it attaches to the zygomatic bone. Okay, but it's part of the temporal bone. Okay, so let's look at this notch right here. This is the mastoid notch. I'm going to look now in notches. And this is a, let me label your mastoid process with an M. Here is the mastoid process. We saw the mastoid, we actually saw the mastoid process on images, particular types of radiographic images that we were looking at in lab on Friday. And I could tell it was a mastoid process because I could see it was perforated with a lot of holes, a lot of sinus cavities in there. But this notch in red is a muscle origin. And so that's why you need to know about it and know where it is and label it on your skull. It is an origin of the posterior belly of the digastric muscle. You don't have to know that now, but you know, when you study for your final and you go back to that, it's going to help you with that. So this is not something you need to know, memorize for your test, but I just added there so you know why you need to know about that. So that's the mastoid notch. There's another fossa here, the temporal fossa. The temporal fossa includes other bones. It's not just that squamous fan-shaped portion of the temporal bone. So it goes way up along the side of the head. And it's the origin for this massive temporalis muscle. So you need to label the temporal fossa on your skulls. And you'll just take a marker and outline it, or a colored tape and outline it with that, and label it with a number or a code. And that's the temporal fossa. It's that whole, really almost the whole side of your head. And that helps you close your jaw. That giant muscle helps you close that jaw. That means when you get bit by a 3-year-old, it's going to hurt, as I have been. Another important fossa is the mandibular, the glenoid, or articular fossa. All three are separate names used. We usually call it the mandibular fossa, but you will see it called the glenoid fossa or the articular fossa. Any one of the three is correct. All right, so that is this depression in the bone under here. Okay.
So we can name any of those 3 names.
Yep, it could be any of those 3 names would correctly name this fossa. Okay, the mandible of your skulls insert into a big rubber socket right here. And that's in that rubber piece is in the mandibular fossa. Okay, it's inferior to the zygomatic process of the temporal bone, and I will outline that in a different color. Let's make it green. I'll underline it here. If you look at your skull, here is, oops, I'll do it over here. Let me just think here. Here is the zygomatic process. It comes up and touches the zygomatic bone here. That is your zygomatic process. So this fossa is the temporal portion of the temporomandibular joint, or TMJ. Okay, we call this the TMJ for short, for obvious reasons. Okay, so because this fossa is on the temporal bone, temporomandibular, the mandible joint, and that's it, the whole joint here. Okay, and the fossa is part of the squamous portion of the temporal bone. Okay, that zygomatic process is part of the squamous portion, and so this fossa is as well. Remember that squamous portion was that whole fan-shaped portion, side portion of the temporal bone, if we continue it up here like this. The articular eminence is the anterior rim of that fossa. I don't have articular. That says glenoid right there, believe it or not. But this is the articular eminence. I'm going to get it red. There is your articular eminence. That's that part that dips down right there. It is this entire anterior rim, however, of this fossa. Okay, it's not just that little V. It goes, to the middle of the skull here is probably what we're seeing some of it here too. Okay, that's that articular eminence. Called the glenoid or articular eminence. If it was the articular eminence of the articular fossa, that's a little confusing, right? Oh, I wrote glenoid here. I meant to write articular. But the fossa has three names, but in this case, we're looking at the articular eminence. It's a ridge of bone that forms the anterior portion of that fossa. And it's an important landmark of the temporomandibular joint. So here you see it, you find the condyle of the mandible, and it's this anterior eminence here. You see it this way from the lateral view, but again, remember, it's a whole ridge that forms the anterior edge of the fossa. I'm just adding here also this tiny little fissure right here. I'm going to put it in a different color. Okay, I'll do the orange, it's similar to the yellow. And this is the petrotympanic fissure. And one of the nerves we'll be talking about to the oral cavity exits the cranium from this fissure. It's right there on the anterior rim of your acoustic meatus. It's a petrotympanic fissure, okay? And it's where the chorda tympani exits. The postglenoid process, again, like it says, post meaning posterior to, glenoid, the glenoid fossa, and that is that posterior rim of the mandibular fossa. And here is your postglenoid process right here. So your petrotympanic fissure is right in just inferior to that process. So let's, oops, let me get the color again. I'll do that again, it's orange. Your petrotympanic fissure, get it? No, it's still red. Is right here, okay? So you see they're right next to each other. Any questions? Okay. The alveolar process, that's a review. You know the alveolar process. And you see it here in the skull image where the cortical bone has been removed, so it reveals the roots of the teeth within the alveolar process of bone. Pretty cool, right? Okay, we're on the maxilla. I forgot to introduce that. I was hiding up here. The anterior nasal spine is this projection of bone at the base of the nose, and that's part of the maxilla, and it's the anterior nasal spine. An important foramen located in the maxillary bone is the incisive foramen, and it is right underneath of the incisive papilla. So you see it here on this image as this little structure right here. It's actually a hole in bone through which blood vessels and nerves to the anterior palate exit to supply those the gingiva. It is also seen as this oval shadow on an X-ray, barely visible, but it's just that little bit of darkness right there. And that is your incisive foramen that you will see between the roots of the central and maxillary central incisor teeth. So that's a very important foramen. There is a sinus cavity within the maxilla, and you see it, here, and you see it in a drawing here, and you see it here, coming down. That's the floor of the sinus over the roots of your maxillary molars. Okay, so it's a bony cavity, the maxillary sinus. Up here we see something that we looked at earlier, which is I'll do it a different color, the frontal sinuses, just to see them in comparison. You see here, you see all kinds of compartments of those sinuses. All right, and you see a little nasion right here too. And this is a lateral cephalometric X-ray. It is taken for, orthodontic assessment, but you see that suture right there of bone between the nasal bones here and your frontal bone here. It's pretty cool, isn't it? But again, the maxillary sinus, this is why sometimes people get a sinus infection, they go to their dentist because their teeth are aching. Now, the palate, the hard palate that forms the roof of your mouth is formed by processes of the maxillary bone, okay? And these are the palatine processes of the maxillary bone. Here, there's one on this side, and there is one on this side. These are the palatine processes of the maxillary bone. And they join in the midline at a suture called the median palatine suture, which is indicated by that red bracket, but you can see it's right here, the median palatine suture. What structure, what anatomic structure covers the suture here? In this portion, basically.
The raphe.
The raphe, the median palatine raphe. So these are the palatine processes of the maxillary bone, right and left. Two processes that come out horizontally, they join at a suture and form the hard palate. Patients who have certain very narrow arches may go through a palatal expansion process. And what they do, the orthodontist or dentist does, is they place a device in the palate, a mechanical device, Okay, and it might be right here with, and then it'll have extensions to this side and this side, this side and this side, and you put pressure on that and it opens up that suture and it widens the palate to create more space for teeth. And it's quite a process. It's a palatal expansion process. It breaks that suture. And then they hold it in place, bone fills in, it heals up, it's done. Okay, the infraorbital foramen is just like the word said, infra or inferior to the orbit. So the infraorbital foramen is here, okay, and it's right under here on this angle of the image. It is the opening for the infraorbital canal, all right, and the infraorbital canal goes from here through the bone of the maxilla and exits at the infraorbital foramen. The infraorbital groove is right here. You see this little depression here in the floor of the orbit on that process of the maxilla. So I'm going to outline the entire maxilla here in this image. It would be, your infraorbital groove would be down here in the eye, if I could make a mark here on the top. Let me do that for a moment. Okay, and let me put the canal. I should put that in like dotted lines. So I'm going to do the canal, the infraorbital canal, like that. It's within the maxillary bone. So an important nerve to the upper teeth comes through this region and travels through the infraorbital canal, and it exits out here to supplies the lips and face. Let me outline the entire maxilla per se. Here in green, I'll put that in green. All right, here's your maxilla. It's coming along here. Here's the infraorbital process of the maxilla that forms the floor of the eye or orbit of the eye. And then here's the maxillary bone in green. So you see that these landmarks are part of the maxilla. We often don't think of that, you know, up in here being part of the maxilla, but it is. Everybody good? Here you see it on this diagram, that this nerve to, you know, the upper teeth here comes through, but here it is in the infraorbital groove. Do you have this diagram? Here is, there is the infraorbital canal going through the bone. You see it kind of, you know, over through a faded bone here. And then at the end is the infraorbital foramen. Right there. There is a dental injection called the infraorbital nerve injection, where you have to take the needle, place it up in the labial mucolabial fold, and palpate the infraorbital foramen, and then inject. You move your needle up to that foramen and inject this nerve here. I had to do that for the New Jersey, my New Jersey anesthesia permit. Oh my God. I've never seen it used in practice. I couldn't believe they made us do that. Pretty cool though, really. Okay, some fossa now, okay? The canine fossa. the canine fossa you are going to be labeling. You're going to be labeling this infraorbital foramen too, just so you know right there. You're going to be doing that foramen, okay? You're going to be also labeling the canine fossa. I'm going to put that in blue here. And the canine fossa is superior to and distal to the root of the maxillary canine. So it's right in there. Okay, that's the canine fossa. So I want you to label that. It's a muscle to the lips originates there. The lateral fossa is more associated with the lateral incisor. Again, it's above or superior to, and then distal to the maxillary lateral. So right about here, okay? So that's the lateral fossa. We can't see the canine fossa on an x-ray, but the lateral fossa does show up, and I'm going to outline it here because it shows up as this darkness around the root of a lateral incisor. And it's because it's a fossa there. The bone is thinner in its dimension. And so you see it as a shadow, and shadows in bone can be infection that has destroyed bone, or it can be normal anatomy. So this is an important feature for you to know because it can fool you on an x-ray. Because you say, why is that so dark? Oh, and it's just the normal fossa there. Hey, how about that? Okay. The palatine bone, okay. This bone's a little difficult. I'll outline it in green on this side. So you see this bone here. It does pop up and you do see it actually, the little tip of it here in the posterior orbit of the eye. Believe it or not, here is your palatine bone. All right. On this inferior image of the skull, I see it here. Okay, so it forms the posterior hard palate. Here's the maxillary processes here, the palatine processes of the maxilla up here, and then behind them is this little thin edge from the palatine bone. And what we're looking at here is on the inferior aspect, we're looking at these plates right here. This is where we're looking, right here. So it's an L-shaped bone. It's way back in the posterior region of your palate. Gosh, okay. So these horizontal portions indicated here by this yellow line are the horizontal plates of the palatine bone. You see it. You see the base of them here laterally, and then I have a dotted line here in yellow indicating that it travels medially to the midline of your hard palate also. It's a very, three-dimensional bone. In red, I have the vertical plates of the palatine bone. So here you see a part of it, but then as it goes, it's still internally here, and it travels to the floor of the orb, or the actually the kind of the medial aspect of the eye, orbit of the eye. And you see where it is showing up in the orbit right here, right there in green. So you see it traveling up vertically like this. So it forms the part of the walls of the nasal cavity, the lateral walls, the outer walls of the nose. All right, and then it ends in the orbit. It has a tiny little piece at the tip of that vertical plate that ends up in the orbit of the eye. The zygoma is missing here. I took it off so you could see more of this bone in the skull. Okay, so this is your vertical plate, you know, indicated by the red line going vertically in the head. And then here is the horizontal plate indicated in yellow, and it is, you know, horizontal in position. So it forms this big L in the back of your nose and palate. Okay. It's amazing. The palatine bone is ends up in the orbit of the eye. Huh. Amazing. So there's some sutures here that are associated with this bone. There is the transverse suture, which is this beautiful ziggity zaggity suture right here in the posterior region of the palate. So it's between the palatine processes of the maxilla, I'll note with a P, and the horizontal plates of the palatine bone, which I'll note in green. Here and here. Those are the horizontal plates of the palatine bone. So the transverse suture transverses the palate from side to side, right? It's like a transverse ridge, transverses across, you know, the occlusal surface when one cusp to another. This is the transverse suture that goes across from the left to the right side of the posterior hard palate. So what I've indicated in green are actually plates of that palatine bone. They're not part of the maxilla. Everybody okay with that? Okay, this is part of where you work, guys. You really need to know these things, okay? You're not just technicians. You're, you know, you've got a license and a degree. So, okay. So back to the nasal cavity. What time is it, guys? We need a break, don't we? It's 10:28. So let's take like a 10-minute break and come back at 10:38, okay?
Okay.
I will stop the recording.
Thank you.
You're so welcome. Sorry. If I ever note break and you need it, just let me know, okay?
Okay.
Sorry.
Miss Simmons, are you going to be posting these, or like
They are.
posting the recording?
I'm going to
Okay.
try.
Okay.
I emailed the guy who does it last week, and I said, here's the deal. I need it by Friday of the week of the lecture. Not whenever you get to it. I need it by Friday. Can you do that? And he said, well, I'm on vacation next week.
Huh.
So I'll see if somebody else can do it, but he never answered my questions. I said, my
Okay.
students need it by Friday. So I'm going to try to get it posted. But
Okay.
that's my problem, guys. I got to wait for Zoom to download it to me, send me an email. Then I have to email it to a technician here at Del Tech. Then he's got to find, or she's got to find the time to do it, and then email it back to me. And if they've got a big meeting or something where the president wants them to, you know, work for him, then, you know, dental anatomy and head and neck kind of fall by the wayside. So I'm going to try. I've also figured I'm not going to video every lab. I'm going to do the second Wednesday lab and video that, and then I'll publish that rather than trying to video every lab, because then you know, that's 4 videos a week times multiple emails. There's my story. All right, so I'll see you at about 10:38.